Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there are no new cases of COVID-19 to report. The total number of cases remains at 304. No individuals are currently hospitalized and there's no one in ICU. As of this morning, 292 individuals are listed as recovered. There are 5 active cases. Just to provide an update on some of the recent cases over the weekend. So on Friday, this was a female in her 30s who was traveling from Ontario and was self-isolating at the time. On Saturday, 2 males in their 30s, and Sunday, a male in his 20s. All 3 of those were household contacts of a previous case. All of these in the Winnipeg region. As of yesterday, an additional 2,125 lab tests were performed between June 12 and June 14, bringing our total to 54,381. So last week we announced a number of changes that are proposed for Phase 3 reopening, and I encourage Manitobans to continue to provide their feedback at engagemb.ca. And as Manitobans know, we've done quite well. Our numbers have remained favorable, but certainly COVID-19 has not gone away. We still need to deal with this virus moving forward. As we reopen, it's likely that we will see and continue to see new cases identified, and we'll continue to identify them early, perform contact tracing and isolation to limit the chances of ongoing community-based transmission. We had a number of precautions in place that we've gradually been loosening over time, and we had this in place to protect those at most risk, as well as to not overwhelm our healthcare system. At this point, our numbers have maintained favorable levels. Manitobans have learned to live with this virus, and we're going to need to continue to learn to live with this virus. We can never be in a zero-risk situation, and so as we reopen our economy, we have to continue to accept some level of risk. We continue to follow a number of indicators daily, so including case numbers, our test positivity rates, the community-based transmission rates, as well as many demands on the healthcare system. And there certainly won't be a single indicator there that would make us dial back our reopening strategy, but we'll look at a number of things over time to decide on whether we continue with our reopening strategy or to implement measures to further restrict things if we saw much community-based transmission. So we know that we take risks in our lives and many other aspects, and so this is not unlike that there. Manitobans know the ways to reduce their risk for COVID-19. That includes frequent hand hygiene, to limit time in crowded, enclosed spaces, practice physical distancing whenever possible. And what's really important for all Manitobans to do our part is to not be out when we're ill, when we're showing signs of respiratory illness. We cannot be going to work or school or out in public when we're ill. It's really vital to our success moving forward. And so with these Phase 3 plans, we're loosening a number of restrictions, but our numbers show us that this is a safe time, a prudent time to be doing this, and we'll continue to watch things very carefully. Those that are at increased risk of severe outcomes, those over age 65, those with underlying medical conditions, those with immune compromise need to be extra careful to limit their chances of being exposed to COVID-19. Practice that physical distancing at all times, frequent hand hygiene. Manitobans should continue to access credible information at manitoba.ca/COVID-19. And once again, thanks to all Manitobans for your work on this endeavor. And I'll pass it over to Lanette.
Thank you. Good afternoon, everyone. My name is Lanette Siragusa, the Chief Nursing Officer from Shared Health. I would like to begin today by announcing a couple of significant milestones in our health system, anniversaries really. June 12th marked the 20-year anniversary of the publicly funded midwifery program in Manitoba. Midwives have continued to work throughout the pandemic, providing mothers and families with prenatal, labor and delivery, and postpartum care. So I'd like to thank all the midwives out there for your contributions to patient care and to our health system. Also, yesterday marked the 10-year anniversary of Family First Home Visitor Day. The Family First program offers home visiting supports to Manitoba families with children from pregnancy to school entry. Despite COVID-19, these community health workers have continued to help Manitobans develop their parenting skills with doorstop and outdoor visits, phone calls, as well as virtual visits. So congratulations to all involved in that program, and thank you for your efforts in helping Manitoba families. Congratulations on your anniversaries. On to operational matters. We have spoken at length about the efforts to gradually and safely resume various clinical activities across the province. And these activities also include Transplant Manitoba's Gift of Life programs, both the donation and the transplants. So at the beginning of the pandemic, transplant programs were put on pause to protect highly vulnerable patients, recipients, and donors from the virus. And access to medically urgent kidney transplants was maintained throughout. And as the curve has now flattened and those services can now be fully restored again, so the adult kidney transplant program resumed performing deceased donor kidney transplants in May, and new transplant assessments are now being triaged and patients are being seen. There are plans in place to resume transplants through the Living Kidney Donor Program, and the goal is to start that up again at the beginning of July. Appointments are being rebooked with the intent of conducting transplants starting next month, assuming that the community spread of COVID-19 remains low, like it is. The opportunity for deceased donations has continued to be available to Manitoba families throughout the pandemic. And Transplant Manitoba will continue to review its plans for service resumptions in the days, weeks, and months ahead to ensure that patients, recipients, and donors remain safe. I just wanted to give you a weekly update on the testing of healthcare workers in Manitoba. So we have not had any positive cases of COVID-19 involving healthcare workers in more than a month. 338 healthcare workers and first responders were tested for the virus in the past week. And since the pandemic started, 26 workers have tested positive for the virus for non-travel related reasons, and all 26 have recovered. A reminder that we began tracking the number of healthcare workers and first responders being tested for the virus on April 10th. And in that time, 5,225 have been tested, and only 7 of those tests have come back positive. So with that, we can open the line to questions.
Thank you. Normally, I would say the reporters on the line have a preliminary question and a follow-up question and introduce our first reporter. However, due to some gremlins in the line, I will be asking the questions. This time from Steve Lambert of Canadian Press. Please provide details on the cases announced since Thursday. Age, health, region, the source of transmission, such as travel or close contact.
Yeah, so we discussed that in the in the prelim here. So the Friday's case was a female in her 30s, which was travel related and was self-isolating at the time, so limited contacts. The other three were two males in their 30s, a male in his 20s, and they were household contacts of a previously known case, and all four are from the Winnipeg Health Region.
And as a follow-up, Steve asks, how many clusters are there, and what are they? Businesses, healthcare facilities, what might they be?
Well, so there currently isn't a cluster. We would consider all these. We only have the 5 active cases, four of which are come from a single household. But other than that, we don't have any current clusters.
From CTV Winnipeg, John's questions, a new poll is showing that Canadians are tiring of social distancing. What would you say to those people? Is there anything health officials can do to convince these people to keep up their efforts?
Yeah, so I think, these times have been difficult on Manitobans, Canadians, and throughout the world. And so we've been dealing with this virus for quite some time now, had to take some significant steps to protect ourselves, to protect the ones that we love, and protect our, healthcare workers. And so just like anything, it becomes more and more challenged to stick with that over time. We have seen favorable numbers here, and that's why at the earliest and safest times we start to reopen the economy and limit our restrictions just for that reason, to ensure that people are restricted for the shortest amount of time and the least restrictive means for as necessary. But it's clear that this virus hasn't gone. We've seen this virus still circulating in Canada, and certainly in the U.S. and other countries. We've seen in other countries where loosening has occurred, there's been a resurge of cases. So we still need to deal with this virus. So we want to loosen things up, but we're doing so in a safe manner. If people are following the recommendations, then it is safe to be out and to take part in the reopening of things in Manitoba. But we always have to be wary of this, that we still need the physical distancing, we still need the hand hygiene, and we still need people to stay home when you're ill.
John's follow-up question, parents are being asked to give their feedback about potential return to school scenarios this coming fall. What sort of measures do you believe will be required to best ensure the health and safety of the students?
Yeah, and with this, it always comes back into the basics of this virus, and this virus is transmitted predominantly by those who are showing signs of illness, and predominantly through close, prolonged contact with them. And so our measures are always going to be based on that. So as we move back to school, as we move back to work, we can't have people showing up who are ill. So that's number one, is that we have to have ways of screening people. We need people to do their part and not be showing up to school or work when they're showing symptoms of illness. Physical distancing is always important. It may not be something we can do at all times, but whenever possible, it should be taken part of. And any precautions that can be, the desks seated further apart, only brief exchanges. Things like large groups, like assembly, should be avoided. So there's a lot of things we can do to put in these precautions.
From Carol at the Free Press, were any of the latest COVID-19 cases people experiencing homelessness, and why wasn't that information made public?
We'll make information public whenever we feel that it was putting Manitobans at risk. And so that's been the message all along, and it continues to be the message. So if many Manitobans were exposed and we're unlikely to be able to have a method to reach contacts or identify contacts, then we're going to announce that. In these cases, that's not the case, and that's why those any further details aren't necessary to protect Manitobans.
As a follow-up, How many people are in the self-isolation shelter for those experiencing homelessness? Have any more sought shelter there in the past week?
I don't have the exact numbers, but I can definitely get them. And I do believe that there were people who went into the isolation center in the last week. Yes.
From Global, Marnie's questions. A few weeks into phase two, would you say the small increases in cases are reflective of the reopening plan and loosening restrictions?
So it doesn't appear. I think that our message to Manitobans is that we're going to see cases of this. We have to expect to see cases. We have to learn to live with this virus because this virus isn't going away. So when we see cases like this, we can't be deterred from our progress and our reopening plans for these numbers. And then certainly when we look at these type of the cases we've seen, these last four are not community-based transmission. They're either related to travel and we're self-isolating at the time, or we're close household contacts of previous cases. So again, limited contact. So these cases all appear to be related to travel or to close contact with a known case.
As a follow-up, with the amount of businesses reopening and the amount of guidelines they have to follow, how can we stay on top of enforcement? Will additional enforcement measures need to be taken?
I think the message right from the beginning was that almost all Manitobans follow the public health advice, and we found that the businesses are no different. That almost all follow it quite well. Some are found to be not in line with it, but all it took was a brief intervention, education, just clearing up some things, and everyone's on board. And very only rarely do we need to look at enforcement of these things. And so enforcement is in place. It can occur, but it's usually not the most important thing. Almost all businesses are concerned about their business, their employees, and their customers. So everyone's been following public health advice, and our numbers have been showing that Manitobans have taken this seriously.
From the Brandon Sun, Drew's question, with the requirement to self-isolate for 14 days after travel from western provinces in northwestern Ontario ended, is Manitoba Health expecting to see a surge in COVID-19 cases after phase three comes into effect?
Well, I mean, I think we've always said we're going to still see cases, and so we're going to need to expect it, need to live with this virus. People coming from those jurisdictions may not be required to self-isolate for 14 days in the next phase, but will still need to self-monitor for symptoms. We still have people who, again, not showing up to work or school when they're ill, not being out in public when they're ill. So we have a lot of mechanism in place, and Manitobans, Canadians have learned to live with this virus and to protect the people around them.
A follow-up question from Drew. Does the province have a timeline for when the self-isolation requirement with other provinces and regions of Ontario will be ended?
Yeah, it's not a timeline. It's based on the epidemiology in those regions. So as we see the rate of transmission declining in those provinces, then we'll start to consider lifting that 14-day isolation period for those provinces as well.
From the Winnipeg Sun, Scott's question. An Angus Reid poll today shows a drop in compliance, particularly in young people, when it comes to social distance and best practices. How big of a concern is this, especially in light of the consistent messaging from the province?
Well, it's like we were saying, it's been difficult times for everyone, and I think we had Manitobans were following our advice quite well. Our numbers show that. But it was some difficult restrictions in place. We've been able to loosen them because Manitobans have put us in this position, and so we still want Manitobans to take this virus seriously. We still need to take precautions, although we're in a position now to start loosening a lot of those precautions. So this virus hasn't gone away. And it's probably not going to be going away in the foreseeable future. So we need to learn to live with this virus. I caution against a return to normal, but certainly with our reopening plans, it is safe to be to be partaking in these reopening plans. Certainly those at increased risk, those over age 65, immune compromised or medical conditions need to be extra cautious. But I think this reopening strategy is quite safe. It's prudent for the numbers we have, and I'd encourage Manitobans to make those choices on their own to decide on their risk tolerance.
From CBC Manitoba, Aiden asks, the most recent weekly epidemiological data released today indicates Manitoba had recorded a total of 6 outbreaks as of June 6. The data for the week prior to that shows only 3 outbreaks. So can you clarify that? Did we record 3 new outbreaks in the week of May 30 to June 6? Where were they, and what can you tell us about them?
Yeah, we wouldn't have had 3 outbreaks during that short period of time. I'll just have to look back and see. It's likely just what we defined as an outbreak and definitions that way. So you can see our current case numbers are quite low. Our active cases are low, so we're not dealing with that many outbreaks in the last few weeks. So I can look into that and clarify that.
And as a follow-up, any update on the province's efforts to procure antibody testing kits and plans to use them?
It's still in the early stages, and so we're looking right now to do a seroprevalence study, and so usually we would take a somewhat random sample of blood that's been collected for other purposes and test for antibodies. And so again, with these seroprevalence studies, it's trying to give us a sense of what percentage of Manitobans actually were infected by COVID-19. What we don't know is whether the presence of antibodies confers immunity, or what type of immunity, or for how long that immunity lasts. So this won't be a study that includes telling people that they are immune to COVID-19. It's going to be completely a population level seroprevalence study to try to estimate the amount of Manitobans that have been affected by COVID-19.
Well, thank you. This concludes today's media briefing, and we thank everyone listening and watching for their patience. Thanks again.
Thank you.
Thank you.